Meet the Ng family. Daddy Kelvin is a busy man running a beach resort. However, in his free time, he likes to conquer the virtual world with his two older boys. Mommy Adele spends most of her day being a personal chauffeur to her 4 boys, but still makes time to experiment with blogging. Thane, the eldest of the brood, is an affectionate big brother. He loves animals and has adopted assorted pets from fishes to a huge terrapin. 7-year-old Bowie is the artist of the family. He loves to draw and also plays the piano and the violin. Three-year-old Sky has a sunny nature. He loves playing with his trains and is generally chatty. Although quite a bit younger than his 2 older brothers, Sky still tries his best to keep up with them. Baby Cody may not know many words yet, but he can still make his presence felt. Like most young children, the boys of the Ng family have their share of common colds and the flu. A year ago, though, Bowie was unfortunate enough to catch the hand, foot and mouth disease at his kindergarten, which had an outbreak of the disease at that time. The hand, foot and mouth disease is caused mainly by the Coxsackie virus and less commonly by the other viruses in the enterovirus family. The incubation period for the virus is usually 3 to 7 days, and the symptoms include fever, headache, loss of appetite, sore throat, rashes with small blisters that may be painful, and ulcers in the throat, mouth, and tongue. Adele was concerned by how fast hand, foot, and mouth disease spread in the kindergarten.
How did my child catch the hand, foot, and mouth disease?
Pediatrician Dr. Arif Taibali has been with the KK Women's and Children's Hospital since 2001 and specializes in children's emergency.
Hand, foot and mouth disease is caused by direct contact from person to person, by contact with the saliva, nasal discharge, feces, or even fluid from the rash of an infected child. It is very common for hand, foot and mouth outbreaks to happen in kindergartens and child cares. Well, children are less likely to have good hygiene practices, and they often put the toys in their mouths and they share these toys, and so the spread of the disease from child to child is a lot easier. But the good thing is that hand, foot and mouth disease is usually a mild disease, and children rarely suffer serious complications from it.
With 4 children, Kelvin and Adele were very worried for their other children when Bowie came down with the disease.
Who in my family are most at risk of getting it?
Within a family, a sibling can pass hand, foot and mouth disease to the other children. The children aged less than 5 years old are the most susceptible. Everyone in the family is at risk of infection, but not everybody who gets infected actually becomes ill. And it is those aged less than 5 who are particularly susceptible to infection as well as illness. And this is because they are less likely to have antibodies or immunity from a previous infection. Or if there is a child in the family who is infected with hand, foot and mouth disease, the key to prevent infection to the other children is good personal hygiene. So one should always wash your hands regularly, especially after coming into direct contact with the child or changing the diapers of the child. And before handling food, hands should always be washed. You should prevent the other siblings from coming into contact with the personal items of the infected child, such as toys, utensils, books, towels, and clothing.
Bowie recovered from the disease after about a week, which is the usual time it takes someone to recover from the disease. But Bowie's parents kept him home for another week just to make sure the disease had run its course. Now that he is in primary 1, his parents are still worried.
Now that my son's gotten the disease, will he get it again?
Hand, foot and mouth disease is a viral illness caused by the Coxsackie virus, as well as a group of variety of other viruses within the enterovirus family, and there is no vaccination against this virus. Once you have contracted hand, foot and mouth disease, you may develop specific immunity to one particular strain of the virus, but you still can get infected by another strain within the same family of viruses. Good personal hygiene is the best way to prevent hand, foot and mouth disease. And if you know that there is someone in the family who has already been infected by the disease, then you should avoid contact and maintain good personal hygiene with hand washing.
Join us for part 2 of this series as we find out more about the possible complications of this disease and ways of preventing it.